Your name and why you're at the Clinton Global Initiative University.
Sure. My name is Dr. Lora Brown, and I am the Chief Medical Officer for the Wake Up campaign, which is a program that's part of a 501c3 organization called the Pain Truth, and it is a community prevention campaign that involves education with the intent to prevent first-time use of prescription drug abuse. And it's a kind of in-your-face program that bases itself out of high schools to really try to reach young people with the information about the dangers of prescription drug abuse, as well as the biological consequences that occur when people use those. I'm here today because I was asked to serve on a panel about the issue of prescription drug abuse in the United States and the epidemic proportion of deaths that are being caused by this epidemic.
So why did you decide to get involved in this cause? Was there any specific story or anecdote that led you to this, or was it just because you saw the problem in your daily work?
Well, I'll give you the long version. About 5 years ago, I was a practicing pain management physician in Florida. I was also, at that time, the president of our state professional society, which was the Florida Society of Interventional Pain Physicians. Our organization was working very diligently trying to lobby for new laws, specifically a law that created a prescription drug monitoring program, which we felt would be a very important tool for physicians to be able to use to help fight doctor shopping. We thought that was important at that time. That was at the time that the pill mill crisis was at its height.
Explain what the pill mill crisis
Sure.
is.
Sure. The state of Florida had a real problem with clinics. I say clinics because they were really legalized drug dealerships, but they were pain clinics that were literally writing thousands of pills at a time of deadly concoctions of controlled substances, addictive medicines like opioids and benzodiazepines and muscle relaxants and sleep medicines all at the same time, and giving them in very large quantities to people without doing any real physical exam or medical evaluation or diagnostic evaluation. So, when you say legalized drug dealing, it's really kind of what it was. Oh. And since then, fortunately, due to the efforts of many, many people in the state of Florida, there have been new laws that have passed that made it very difficult for these types of clinics to exist today, and most of them have been shut down.
Okay, if you want to continue your story
Sure.
that you were saying
So at
before.
the time, we were fighting this pill mill problem in the state of Florida, and there was a real problem with perception among the public. We would have people who would say, I don't want to go to a pain management clinic because I don't want to get addicted. So there was a misperception about what a legitimate pain management physician was and what a pill mill physician was. And at that time, we felt it was, we being my organization, I felt it was important to do a public awareness campaign. So we started a public awareness campaign, and that's actually how the Pain Truth was started. That started out as a 501c3 program that started out as a public awareness campaign to try to educate the general public about the difference between real doctors, legitimate doctors, and pill mills. At that time, we were bombarded with responses, with calls from people, from the general public saying, I don't know what to do. I have an addiction to these medicines. I don't know how to get off of them. Or, my daughter, my husband, my brother, somebody in my family's addicted. Or we got calls, and this is the one that really moved me, from mothers saying, I lost my child. I went in to wake them up, and they had overdosed in their sleep, and I couldn't wake them up. Hence the name Wake Up. Our goal is that everybody wakes up tomorrow and every single day. So Wake Up developed after that experience. We realized there was a problem. We realized, this was an epidemic problem. It wasn't getting any better. And I truly believe that one of the ways to address this epidemic is through prevention. But prevention's a tricky thing because once you start these drugs, when that switch is flipped in the brain and you become addicted to these drugs, it's a lifelong battle. So you've got to really prevent first-time use. And that's what we've done. We've created a comprehensive campaign that uses many different pieces: community activism, media, basing it through science-based education at high school level, involving parents and educating healthcare providers at the same time, all in one program called the Wake Up campaign. And again, we are focused out of high schools. We've reached down into middle school levels. We're getting a lot of requests now at the college level as well, because there's a real problem on college campuses, especially with stimulants.
Now, you mentioned some of this advocacy and some of the messaging is pretty direct to people. Do you want to kind of explain kind of the message that you're putting forward to some of these younger students who could be susceptible to this abuse?
Yeah, I said in the panel discussion earlier that it's very important to understand who your target audience is and to involve the target audience in creating that message, and that's what we did. We worked with we called it the Millennial Generation Teen Advisory Board. So we had volunteer teens ages 13 to 25. There were approximately 25 of them altogether that we met with up to a year and a half in advance of launching the program, as the program was being developed. So we vetted images with them, we vetted messaging with them, we got information from them, we learned about the cultures on campuses and what was going on and what these kids were exposed to. We got their feedback on every aspect of the campaign that was targeted towards young people. So, and our advisory board is the one that kind of pushed us into the direction of being edgy, if you will. So yeah, our graphics are pretty edgy. They're meant to accomplish a purpose, and that purpose is to get kids' attention, and they do that. But every one of those edgy graphics has a very important science-based or fact-based message associated with it, i.e., you can get addicted after using drugs one time. One pill can kill. Oxycodone, OxyContin is synthetic heroin. It's just as dangerous. Passing drugs around is the same as being a drug pusher. It's illegal to abuse prescription drugs. In some cases, it can be a felony. So the graphics are kind of edgy, but what we've learned, and what we've learned through our pilot program and our outcomes data, is that it does get their attention, and they do receive it well. They think it's kind of cool, if you will. So they'll stop and they'll look at it and they'll read it, and it kind of sinks in.